Texas nonprofit is working together with the Texas Tech University Health Sciences Center to improve care for mental health patients and also for the safety of the staff.
KCBD News Channel 11's Jaden Santos tells us about its new telepsychiatry initiative and how it can help the future of behavioral health. Jaden?
Karen and Abner, the Texas Organization of Rural and Community Hospitals, also known as TORCH, is partnering with the Health Sciences Center to make mental health care more accessible and safer for both patients and healthcare providers. Terry Scoggins, CEO at Titus Regional Medical Center, says Texas is facing a shortage of mental health resources, especially in rural areas.
Regional Medical Center has seen 4 hospitals close within 45 miles of us in the last 10 years. We know the impact of a hospital closure on a rural community. It's devastating.
According to the Texas Health Sciences Center, nearly 1 in 5 adults live with a mental illness, and rural hospital emergency rooms are the primary place mental health patients are taken to.
We also know the impact of behavioral health on rural communities. It's just one of our largest issues that we're dealing with over the last 10 years is the increase in behavioral health patients coming to our emergency department and being boarded in our emergency department.
The telepsychiatry initiative, introduced by TORCH and TTUHSC, allows psychiatrists and other behavioral health providers to deliver psychiatric care online, typically to patients with mental health conditions. Kathy Griffiths, Chief Nursing Officer at Titus Regional Medical Center, believes this type of care can be very effective.
Patients don't need to go to an inpatient center if they don't need to, and you need an expert to decide that, to keep them safe. And so that is the biggest thing. 50% of our patients with the TORCH program don't end up with inpatient care. They're able to go back home and be treated outpatient, which is a game changer.
Griffith says patients who experience acute psychotic events would at times be uncontrollable and would become violent without knowing. Griffin believes the telepsychiatry initiative can help keep staff safer and provide quicker medical help for the patients.
For the staff, they see the patients getting the treatment that they needed. The psychosis is stopped earlier because they're getting the medications they need to stop it. And then on the back side of that, the success stories are beautiful. When they're able to transition home and go outpatient and they get better, that is a game changer for staff. That's really why they're here.
Scoggin encourages all leaders within healthcare to look into behavioral health and how to better serve their patients.
Behavioral health is an issue. It is an epidemic in rural across Texas and the United States. This program has made a huge difference, not only addressing the behavioral needs of our community, but also workplace violence and the stress of our employees, our team members, our doctors, and everyone involved.
Currently, the Texas Health Sciences Center is working with about 15 to 20 hospitals and are hoping to increase that number in the coming years. Karen and Abner.
Thank you, Jaden.